Most women choose to give birth in hospitals. So today I want to share with you some of my top tips to make your birth as calm and as instinctive as possible if you choose to give birth in hospital. Now, due to the very nature of hospitals, many labour wards can have a fairly medicalised, institutionalised feel, with lots of rules, time constraints, guidelines and procedures. If you then add in the influence of white coat syndrome, the natural process of birth can get disturbed, which may lead to an increased need for medical intervention. However, there are some really great ways to help you prevent all of that from happening. Now, my first tip overall is to stay at home as long as possible. Generally, more women go to hospital too soon rather than too late. And the surest way not to have an instinctive birth is to be surrounded with adrenaline-inducing factors and to be frustrated by a long stay in hospital with all of its sounds and smells, routines, guidelines and processes. Now, choosing a birth centre, if possible, is a fantastic way to go because it's a low risk unit and the midwives are much more geared up to support instinctive birthing, and often the environment is much calmer and more relaxed than on the hospital labour ward. However, whether you're choosing a hospital or a birth centre, there are lots of things that you can do to ensure that you create the right environment and a lovely space to birth instinctively. The first one is to create a sense of privacy. Keep the number of people in the room to a minimum. A birthing mother shouldn't feel observed, whether that's by other people, whether it's cameras, whether it's monitors and so on, as it can increase her level of anxiety, inhibition and kind of expectation to perform and get it right. Now think about it from another angle. How easy would you find it to fall asleep knowing that people are watching you? For that reason, many birthing women often just instinctively choose to spend more time in the shower or in the toilet, as it gives them that extra bit of privacy. The next thing is to keep the lights low, to dim the lights if possible, to turn the angle poised lights towards the wall. As mammals generally, they feel safer if it's darker and the lights are not so bright. Plus, it creates a lovely, relaxing, intimate, cosy atmosphere. The next one is chatter. In the serious phase of labour, keep speaking, especially questions, to a minimum. It's the use of language that stimulates the neocortex the most. And if other people in the room want to speak or chat, you can ask them to politely do so outside the room. It's even a good idea to ask for silence during a contraction in the latter stages of labour so that mum can completely focus and feel undisturbed by any noises in the background. Another tricky one is the temperature. It's really important to keep mum warm, and some hospitals do have air conditioning in the summer, which you may not be able to control. So think about bringing your own duvet or blanket, but also a fan, which can help to keep it cool if the heating is high. Now, lots of women who've used hypnobirthing are actually quite unaware of their surroundings when they get into the serious phase of labour. And they have given themselves suggestions to get rid of the adrenaline-inducing factors and not to be affected by them, so they're able to stay calm and focused no matter what is going on around. So when you get to do the hospital tour or you meet your midwives who are supporting you, please do explain to them your plans to use hypnobirthing if that's what you're doing, and that you're keen to have an instinctive birth, and that you'd really like to work with the team to help make sure those needs that we've just talked about are met. Now you can explain to them that you would like to have the room as quiet as possible, that you'd like to turn the lights down and that you'd like to have the door closed. Now lots of hospitals do this anyway, but it's good just to reiterate that. And remember, all midwives have got your best interest at heart and have positive intentions behind everything that they do. However, midwives today have got a tough job and they are bound by procedures, time constraints and guidelines. But on the whole, they are used to caring for mothers who might be more fearful, tense and looking to them for help. And so they may offer intervention and pain relief as a matter of course. However, I know that given the choice, the majority of midwives would dearly love for all women to have the hypnobirthing skills that hopefully that you're going to be learning, as well as the right environmental conditions to birth instinctively. Now, it is essential that you develop a really good rapport with them because they're there to support you, and that you all remain as calm, quiet, and of course friendly while still asserting your needs, and to help protect your birthing space. Because at the end of the day, they are there to help if help is truly needed. And countless midwives that I have known and I've worked with have commented on how wonderful births have been with women using hypnobirthing, and how it has reminded them of why they became a midwife. So you may like to see part of your role as a wonderful opportunity to inspire and motivate midwives who are often stressed, tired, and sometimes demotivated.